Imagine you're a scientist. Spend a lot of time in the laboratory, sometimes on holidays and weekends. It feels like at times you study things that may make only an incremental improvement in the world at best. And then one day, you make a discovery that, if applied, would benefit a suffering part of the Earth's population. You may have discovered a new drug. My research centers around soft tissue regeneration and applied biomaterial enhancement following injury. However, when another laboratory in another country was first to publish results similar to my own, I became angry. While running on a treadmill at 3 a.m. out of frustration, as one does, I formulated the idea to test my therapeutic in the context of muscle disease. If it helped with injury, maybe it'll help with disease. Well, these preliminary experiments were wildly successful and left me asking the question, how do I get a drug from my laboratory benchtop to a patient's bedside? Well, the key word here is approval, but that word represents a process that feels more like a journey. 1 in 4 drugs that reach FDA approval begin at university laboratories, and my laboratory, located in the Department of Kinesiology and Sport Management here at Texas A&M, has a drug that we hope joins that group. And tonight, I'm here to briefly walk you through our journey of advancing a new therapeutic to market. Our therapy has been particularly impactful in a context of inherited neuromuscular diseases called muscle dystrophies. Children and adults with muscle dystrophy learn to walk, run, and jump, and then upon onset of disease, will progressively lose mobility until severe immobility, impairment, and death. We discovered that if you reduce a third-generation biomaterial and inject it into the muscles of dystrophic mice, you could increase the size and function of these muscles and reduce the effects of the disease. So we tested this in over 100 mice, and we discovered benefits as early as 5 days post-treatment and as far out as 140 days without any signs of toxicity. Immediately, university technology transfer teams directed me to what components of the technology might be able to be protected. You see, without protection, my therapeutic would never reach the patient's bedside because nobody would invest money to commercialize a drug that wouldn't potentially return that investment. Once we realized that there were components of my technology that could be protected, I was enrolled in a semester of bioscience business classes to both learn about the process and compete for funding. We were successful in learning that process, and also found that the therapeutic goes beyond just muscle disease. In the context of muscle injury, we can heal muscle that's been injured about 20% faster than normal. So we were successful in 2 rounds of biomedical accelerator funding. The first was to establish proof of concept that we were indeed able to make the muscles of dystrophic mice larger and stronger. And the second round was to establish how long-lasting were these effects. I'm excited to report that we've recently received a Texas A&M University Advancing Discovery to Market Type 2 award to investigate the effects of our therapeutic in a more clinically relevant model prior to seeking FDA designation as an investigational new drug. Only 12% of drugs that make it to clinical trials will actually end up to the patient's bedside. And it's at clinical trials where my journey with this therapeutic will end. But we would be excited for the patient's journey to begin. We would look forward to this therapeutic advancing through phase 1, less than 100 patients, and phase 2, less than 500, and phase 3, less than 3,000. So we've assembled a world-class team. We have a knowledgeable advisory council with both internal and external oversight. And while the chances are slim, as far as drugs go, we're optimistic. We look forward to achieving our milestones and the next chapter in our story. Thank you.